Hey everybody, welcome back to Lessons My Patients Taught Me. I'm Elliot Davidson, family doc here in Solon, Ohio, and this is episode number 76, which means either I really like talking to doctors or I really don't like shoveling snow and doing yard work. Jury's still out. If you're new here, this is a show where we talk about the stuff that doesn't make it into grand rounds, the quiet lessons, the humbling moments, the wisdom our patients hand to us over decades in practice. Today I get to sit down with another person I genuinely admire, Dr. Teri Lash-Ritter. Teri is the president of Cleveland Clinic Akron General, also the president of Cleveland Clinic Lodi, and the president of Cleveland Clinic South Submarket here in northeastern Ohio. In February 2025, so just about a year ago, she became the first woman to hold that role, which is a big deal and about time. But titles aside, here's what I love about Teri. She's a family doctor who has never stopped being a family doctor. She trained at NeoMed, Northeastern Ohio Medical University, which is where I trained. She earned her MBA at Case Western. She joined Cleveland Clinic in 2011, became Chief Medical Officer at Cleveland Clinic Akron General in 2019. And somewhere in there, she kept teaching, she kept rounding, she kept leading annual medical missions to the Dominican Republic, and lots of other things. She's the kind of leader who can talk balance sheets and bedside manner in the same conversation, and that's rare. Teri, I am so glad you're here. Thanks for doing this. Let's grab our coffee and get into it.
Sounds good. Thanks for having me.
So let's start at the beginning, take me back a little bit. Was there a spark that pulled you into family medicine? And at what point did you realize, I might end up in leadership?
There were multiple sparks. I actually tried to ignore the sparks for a long time, but thought about being a doctor. And then I decided in college that would just take too long. And so wanted to be ready to be just out into life. And so I got my degree in dietetics and I worked as a dietitian. Um, And about 2 years into working as a dietitian, I really felt that spark and pull to get into medicine and be able to take total care of a patient versus just that one little piece that nutrition was providing. Um, so I started thinking about medical school, but I was married, I had a child at the time, and it just seemed like it didn't make any sense. But the spark just kept sparking, and so eventually I gave in to the spark as it got bigger and finally started medical school about 5 years after I got my bachelor's degree, married, 2 kids, and then jumped into medical school. And I think I always felt like I would be a family doctor. I thought about some other specialties, but really it goes back to that holistic care, to the lifestyle piece of taking care of patients and communities that really is the core of, who I am as a physician. And so family medicine it was for me. Um, As far as the leadership piece, I mean, honestly, I started right into a teaching role as faculty out of residency, and I really felt like I would spend my entire career teaching and maybe at some point get into being a program director or running a program. And so really leadership was not on my mind in any way that was different from within an education type program. As life will happen, those ideas shifted because I just needed to focus a little bit more on my family and left that teaching position to go into full-time clinical work. But then eventually got into medical directors and leadership pathway. And so it's kind of this journey of opportunity and where you're at in your life and your career that meets and changes your course.
Yeah. And now, you're still doing a lot of different things. You're still seeing patients on the inpatient side with residents. And I'm wondering, what are the pearls that you find yourself repeating, the stuff you hope that the residents remember when it's 2 a.m. and the pager won't stop?
Yeah, I think there's a couple of them, and honestly, I think it speaks more to the art of medicine versus the medical knowledge piece because that changes all the time, right? We have new guidelines, new standards, new information that we're getting, new medications. But I think the things that are consistent over time that I try to teach over and over is, that art piece. And one of them I would say is that a patient have to address their emotions before they will hear the facts. So, for example, if somebody's upset about something, coming back with facts about whatever the issue is, they're not going to be able to hear it until you address whatever that other emotion is: frustration, anger, sadness. And also on the flip side, with positive emotions, if somebody has started taking their medications, their blood pressure's down, they're exercising more, to just ignore that and go straight to facts also is not effective, right? So to be excited for them and to positively reinforce that and feel that excitement for them and with them. And that's really, I think, also the piece that brings you a lot of fulfillment. I'd say the other thing that residents hear over and over from me again is that if there's something you think you should do before you sit down in the call room at night or you leave for home, it's going to be in the back of your mind. I should have checked a lab. I should have checked in on that patient again. Just go and do it, right? That is important. And you should tap into that and believe that piece of your mind. And also, it allows you, when you are off, to be off and not kind of still thinking about that and come back a little bit more fresh and ready to go the next day.
Yeah, I liked what you said about the emotions and never forgetting that you have another human person in front of you, and you have to acknowledge the human side of what is going on in the interaction and the information that you're providing to them and the emotional response that they have to that. That's always a big part of what's going on there.
Yeah, it definitely is. And I think the example I give them is if you've ever gone home after maybe having a challenging day and you walk in to talk to a friend or your spouse and you say, my gosh, I had the worst day and say a little bit about it. And if they just kind of are like, okay, well, what do you want for dinner? Right. Then you escalate it, right? Like, no, really, it was a horrible day. Oh, and it keeps getting worse until they acknowledge, like, hey, I'm really sorry you had such a rough day. Okay, now I feel heard, right? Now I'm ready to move on, to shift forward, to think about the next thing. And I think that anybody can relate to that in their life. And so I think it helps them to understand that perspective from a patient's point of view.
Sure, sure. Now, you've been doing medical missions to the Dominican Republic for many years. So, talk a little bit about what hooked you into that work and what keeps you going year after year.
So, really, I think I had mission work on my mind as soon as I decided that I wanted to go to medical school. But again, I had young kids, and it really wasn't the time in my life to be away, and they weren't able to travel with me at that time. And so, as my kids got older, I said, before you leave for college, I want us to go and do medical mission work together. And it was important to me that they see kind of what else is out there in the world. I think it's a very skewed perspective that we have, and I'm extremely privileged to live the life that we do. But it's very, to really open their eyes and see how most of the rest of the world lives, and to maybe appreciate those opportunities that they're going to have in life and when they go to college. So I felt very strongly about that. So when my oldest was 16, we went to Haiti and had a really great trip in it. And I think, he's 30 now, and I think I still see the remnants of those seeds that were planted during that mission trip. So then I've done that with, well, my three oldest children. I have four kids, and my youngest is 12, so she's not quite ready to go. But, it has been really meaningful in a different way for each one of them. And, for me personally, it's is a chance to really just connect with people without all of the other things that we have in our country around the healthcare environment. Even though we speak different languages, I muddle through Spanish, but I have a translator. It's so refreshing to just connect with people and to feel like I'm able to help in a few ways, to do so in a way that I come back understanding cultural competence in a very different way. And it changes the approach of how I work with patients, how I work with residents, how I lead, because I think it gives me that perspective of really trying to work within where a person is at and be respectful of where they're at without coming at it from a perspective of I'll say judgment or understanding or empathizing. We're all at different places in our life journey, and that's okay. And that's all based on our own skills, experience, and lifetime of, living how we do. And so I think that that's why I keep going back. I love it. I love that I get to bring the residents with me now because, again, just from the standpoint of, I think, hoping to shift their perspective every day in the patients that they work with and planting those seeds for the future really means a lot to me.
Yeah, you're bringing different residents each time, and I bet you see a lot of that aha phenomenon when you have them with you there for the first time.
Yeah, I definitely do. I think even just watching them as we leave the airport, looking around at the environment in Santo Domingo, and then as we travel out into the countryside, we're about 3 hours outside of there, kind of closer towards the part of the country that's across the mountains from Haiti. And just seeing that realization as they see the homes that people live in and the way that they survive every day, out in the fields with machetes, 90 degrees, and it's just so different. But and it's also interesting to me to watch how they react. Some people fall in love with it, as I have. Some people get very emotional. I've had residents and other, people who travel with me get very emotional because it's just so overwhelming to see how others live and to really truly appreciate every day the way that we live, we don't have to struggle in the same ways.
Well, it's great you give them that opportunity and that you have that kind of commitment. So let's be honest, hospital leadership in 2026 is not for the faint of heart. I wonder what keeps you up at night right now and what gives you hope for the future.
Yeah, I rather than giving the list of what keeps me up, probably what doesn't keep me up is a shorter list,
Oh
but
my.
we'll go with what keeps me up. We'll give you the top couples. I mean, I think for me, top of mind right now, of course, is recovering from this water main break event that we had here at Akron General about 11 or 12 days ago now. And so that, of course, is top of mind for me. And I've had a few sleepless nights. But I would say overall, before that, just I'll say when I stepped into this president role, um, I feel the weight of it a lot more than I would have thought. Just the weight of the responsibility of the care that occurs within not just this building, but all of the South Submarket, right? All of the hospitals and ambulatory centers that we have here in the South Submarket. And that, kind of that weight of responsibility of feeling like, when we have any type of hospital acquired infection or safety event, that in my mind, I think, how can we prevent it? How can we do better? How can we change our processes? How can I be more supportive of all of the teams that are working to take the best care of patients? So that definitely keeps me up at night. Beyond that, I think just the some of the challenges just around the national healthcare setting as far as, changes in government payments and the thinner margins that are just reality now for everybody who is in the healthcare world. The closing of smaller hospitals puts a lot more responsibility on those of us who are fortunate to be part of a bigger system and have some of those redundancies and supports and resources that we are privileged to have. But then, the fewer hospitals out there, the fewer physicians out there, the more that we are responsible. And, at what point is it so much that your system becomes not as safe and not as high quality? And so that's also top of mind for me.
Yeah, yeah. We mentioned the fact that, like me, you're a family doc. You're a family doc at heart. And in reality, I wonder how does that shape how you lead? Do you think you approach big decisions differently?
Yeah, I mean, it definitely shapes the way I lead because I think that having, again, looking at patients and communities in a global way, that's what we do as family doctors, right? We don't just look at the person in front of us and look at them in isolation. As family doctors, we think about the family environment that they come from, the community that they come from, how that impacts their health. And so, as a leader, I just take that and it just expands up, right? So, how does Akron General fit into the South Submarket? How does the South Submarket fit into Cleveland Clinic? How can we be the most benefit to our communities? And so I think also just a common sense approach. I think as family doctors, we get innovative in the way that we take care of patients. And I think that innovation spills over into the way that I lead. I'm not as maybe prone to some of the decisions being made because that's the way we've done it. This is the standard process, right? I like to think outside the box. I love change, which is very different from most people. People don't like change, but I love trying new things, seeing what works. And I get really excited about that kind of thing. So I would say that big decisions, you know, I have to make them every day, and I can't really separate my mindset as a family doctor from being a leader who's making those big decisions. So it definitely affects the way I lead and the way I make big decisions.
Yeah, yeah. Now, I'm wondering about your thinking on artificial intelligence, AI. I've been thinking a lot about this recently. My last podcast was about this. I have a roundtable discussion that I'm putting together on AI. It's dominating a lot of my thinking. I wonder what you think about it. Is it our new best friend, our awkward intern, something else entirely? What do you think about it? Where do you think it's heading for us?
Actually pretty excited about it. I think so much one of the I didn't mention this one, but one of the things that keeps me up at night is kind of the disengagement that I see with our bedside caregivers because almost everybody who got into healthcare to connect with people, to care about people, to take care of people. And they do that, but also we ask them to do a bunch of checklists, right? To do a bunch of documentation. And so we have turned what is a very caring profession into kind of a box checker at some level, or a task, somebody who's just trying to get a bunch of tasks completed. And so, what I see as the future, what I would love to see AI do, and what I think it can do, is take some of those tasks and do them, right? And provide that same quality and safety that we have to have for our patients. And then allow the time for our caregivers to truly give the care, right? And get some of that fulfillment and meet those this is why I got into healthcare, and just get back to people's roots of why they chose this profession versus, banking or anything else. So that's what I hope AI will do for us. I've seen a little glimpse of that, I think, with ambience, and helping our providers to have their notes completed without having to be focused on the computer instead of the patient in a room. But I think it's so much farther beyond that, what it's capable of. Do I have fears about AI? Sure, I have fears about AI that, we're going to use it as a substitute for humans in ways that becomes dangerous or counterproductive. But I try not to play into all the fear mongering.
That's good. Yeah, I just saw, Cleveland Clinic put out the video about 5 new ways it's using AI, one of which is sepsis monitoring and kind of alerting docs when this is happening, scheduling in the OR by finding the different, slots that are available and alerting surgeons, how to schedule better with their office. Really pretty innovative ways of using it. So I think there's a lot of ways it can be beneficial.
I totally agree. I'm excited about it.
So, lastly, before we wrap up, I'm just wondering any other lessons that you want to share from patients that stick with you over the years? I'm sure you've done a lot of time in practice with patients. So, anything else you want to share with our audience?
I absolutely do. I think what I have learned from patients is a joy and gratitude in life that I would not have otherwise experienced. So, those the slogan and the sweatshirts right now, everybody's going through something, so be kind. When you're a physician, you get a glimpse behind that curtain for your patients. You see the suffering. You see what they're going through. Understand it at a different level, and I think you can apply it to people that you may not are not your patients, right? But I think seeing the way people are resilient and even in the face of, difficulty, rise to the occasion, find joy. And so when I'm struggling with something that by perspective of some of the illness that you see in your patients is minor, I like to call them first world problems, right? I don't get to park in the same lot anymore. This is minor, right? th- there's always that voice in the back of the head, and that is the voice of my patient saying, be thankful. Be thankful for your health. Be thankful for this wonderful cup of coffee you're enjoying this morning, for the warmth of the day, for the sun coming through your window. And so I think I carry that with me every single day.
Yeah, that's so true. It's remarkable what our patients will share with us and how honest they'll be. And it is such a privilege to be in that position to hear these things and to be able to help them through whatever they come to us. And we're just thankful that they are open with us and that they'll share these things with us. And you've reminded us that we need to be grateful for all the little things that we are privileged to have in our life as well. I'm privileged and thankful for you, and I appreciate you sitting down with me today. So I want to thank Dr. Teri Lash-Ritter for sitting down with us again, and in what I know is a super busy schedule. And thank you very much for being here today.
Yeah. Thank you. I enjoyed it.
All right, have a great one.
Thanks. You too.
The preceding podcast contained discussions of medical cases where names and identifying details were altered to protect the privacy of individuals. The views and opinions expressed were those of the individual speakers and do not necessarily reflect the official policy or position of any affiliated institutions or organizations. This podcast was for entertainment purposes only and should not be taken as medical advice.